We have already told you how diabetes affects the body from head to toe. That is the reason why diabetes can also take a toll on sexual health of a person, especially a man. The chances of that happening increase when the blood sugar level swings too much and too often. Men who do not keep their diabetes in check can suffer from erectile dysfunction, especially if they are older. Erectile dysfunction is the inability to get an erection good enough for sex. This can not only take a toll on a man mentally and physically, but can also lead to emotional turmoil as it may affect the relationship with the spouse or sexual partner. In fact, according to some medical surveys, it has been found that a man with diabetes has a 25-75% chance of suffering from erectile dysfunction. Once a diabetic man crosses the age of 50, then the chances of him having difficulties in getting a satisfactory erection increases by as much as 50%. Above the age of 70, that chance goes up to as high as 95%. Why are diabetic men more prone to erectile dysfunction? A man not only needs to be sexually aroused to get an erection, but needs blood vessels as well as healthy nerves. What happens in a diabetic is a bit complex, as the nerves and blood vessels get affected due to the disease. So even if the man gets aroused, he may not get a good enough erection to have sex. Here are some tips and steps that can help in such a case. Keep a check on diabetes better. Make changes to the diet and lifestyle to become healthier. Quitting smoking and drinking can help. Medical help should be sought as soon as the first signs of erectile dysfunction are noticed. Cross-check the diabetes medication to make sure it's not making matters worse. See a counselor if it is taking a toll on the personal life as well as relationship. If changes do not have much of an effect, one can resort to oral medications that help in maintaining an erection. But that should be under medical supervision, as some of these medicines can take a toll on the heart. Diabetes can prove to be much more than just having high blood sugar levels, and this is something every diabetic should be aware of. Take care and get help on time to make sure that problems like erectile dysfunction do not get from bad to worse, which is very rapid in case of diabetics.